Coming up on Folks, advice from pharmacists on how to use prescription drugs to make you healthier. A visit with the founders of Samaritan House for runaway teenagers in Baton Rouge. And the music of West African star Agboti from the International Festival in Lafayette. All in today's edition of Folks. Hello everyone and welcome to Folks. I'm Sonya Masingale. Today we're continuing our health updates with information from professionals in the field of pharmacy. It seems whenever you hear about drugs these days, it's bad news. But in reality, prescription medicines are helping us live longer, healthier lives. The science of medicine is evolving so quickly that even doctors and other health professionals find it difficult to keep up with all of the new medicines. That's why the Xavier University College of Pharmacy developed their Drug Information Center. Now Xavier and Tulane Universities of New Orleans have combined their efforts to further the cause of keeping health professionals informed about prescription drugs. The professionals who staff the center are finding that patients too want more information about the drugs their doctors prescribe. The Xavier University Drug Information Center in New Orleans exists primarily to supply doctors and other health professionals with clinical information about prescription drugs. Karen Clemmons, a pharmacist, is director of the center.
Our function is service-oriented as well as educational-oriented. We provide information regarding patient drug therapy to healthcare professionals that call us. In addition to that, being located at Tulane Medical Center, we serve the medical center community as well as several of the medical staff committees. And the educational aspect of it is that we are a training site, or this is a teaching site for the pharmacy students, graduate students, as well as the undergraduate pharmacy students. The undergraduate pharmacy students, I should say. And in addition to that, quite a few of the Tulane public health students also utilize the facility in researching their projects for their thesis.
Ann McKnight, also a pharmacist, works as a drug information specialist at the center, a role that's still being developed and defined by pharmacists.
I had a call from a young man who was concerned about a medication that a female associate of his is taking. The lady is pregnant, and they're concerned about what possible ill effects this may have on the child. Calls of that nature require a bit of clarification, because A, the person is calling about a medication that they are not taking themselves, and we do have to be careful about how information is given out. In this particular situation, we asked if the patient had begun prenatal visits. They had not. We also asked what the dose was of the medication, how long the person had been taking the medication, and some questions about the diagnosis. All of these things are important in giving out drug information. So the caller was given general information about the medication and what could possibly happen. But what's most important at that particular point was that the patient herself gets to a doctor, starts her prenatal visit, and inform the obstetrician of her medical history. And that's something that's very important. A lot of people hop around from one doctor to another and even from one pharmacy to another. It's very important to select a doctor and a pharmacist that you feel comfortable with and continue with them, so that when different medical situations arise, you have someone who has a rather complete picture of your health history.
Although the center was founded to handle calls from health professionals only, they are finding the general public is calling more and more for information.
We have been getting an increasing number of calls for persons requesting substance abuse detox or counseling services. And unfortunately, I say it's unfortunate because it really is, because there's a tremendous need in the society for that. We are not a drug of abuse information center, and people look in the phone book and they see the name and they see drug information, and now the term drug is synonymous with drug abuse. It doesn't mean medication anymore, so they automatically assume we're a drug abuse facility. And what we do, we refer them to various places that we think will possibly be of assistance to them.
A lot of the calls that we get from consumers have to deal with side effects. A lot of the patients unfortunately, a lot of the patients will go to the doctor and tell them what their problem is and receive medication, but for some reason, maybe it's because, after they're at home and they've had a chance to maybe relax and think about things, they have questions that maybe they just didn't think about when they were with the doctor. So the calls that we get from the consumers have to do with side effects, have to do with whether or not they can take them if they're pregnant, or whether or not they should take it with food. I think it's little things that are very important, but while they're with the doctor and discussing their chief complaints, they just don't think about a lot of these little things. But then once they're at home and they're in a more relaxed setting, I think some of the finer points come to the forefront, and probably because the pharmacist is more accessible than the physician, who may be with another patient then, or maybe not at the office then, or not at the hospital, they can call the pharmacist and ask some of these questions that maybe they just didn't think about during the process of the examination or the office visit.
With Americans getting older and older and taking more and more prescription drugs, it would seem that there's more of a need for consumer service of this type. Do you see the Drug Information Center going in this direction?
One of the areas that we are going to be moving into is really in the development of patient-oriented information that we can actually send to persons. Historically, drug information centers are set up for healthcare professionals, but we realize with the evolution of society and time, and the lay public or the patient is a much more informed person than they were, say, 15 years ago. It is very important that they do get accurate information, and so we are definitely moving into that area. Another area that is of tremendous concern to us is the literacy problem here. Persons really cannot read their medication, so we're looking at developing some kind of a pictorial standard for a variety of directions or medications. Now, that's not to say we want to keep the society illiterate, so let's give them pictures, no. But we do have an immediate urgency to deal with here, and until the society is more literate, which will take time, not as much time as it should take, but it will take some time, then we need to definitely address the concerns there. So there is a move to making information available to the consumer, but that won't delete or take away from the drug-specific, patient-oriented information that we give to healthcare professionals.
Anthony and Brenda Chappell are registered pharmacists who own a small drugstore in the heart of a large black New Orleans neighborhood. They have a great deal of concern and personal interest in the customers they serve. They find that an ailing economy affects not only their business, but the health of their clients.
Here in this particular community, it's predominantly black, and you deal with people who have the less healthcare resources available to them, people who are less apt to practice preventative healthcare measures, who are less represented in government, but yet the resources to help those things are not there. The people actually suffer. The poor actually suffer. The businesses in the area actually suffer.
Well, we're in a very depressed area of town, and as if the whole city and state is not depressed, but especially in the section of town that I operate. And for the most part, 80 to 90% of my volume is on third-party prescriptions, be it insurance companies or the state's welfare system. And back in November, when they had the massive cuts with the drugs, it dipped into considerably into the volume. A lot of the medication that used to be paid for are no longer payable, and the people don't have the money to pay for them. So usually they go without, and as a result, as getting back to your question, the volume goes down. They can't afford it.
Why are prescription drugs so expensive?
Prescription drugs are a rare bird in that that patient that received that prescription, before it got there, you have to back up and see how far it has come. From the years and years of research, paying the scientists and so forth for research and development, the trials, the testing, animal testing, human testing. After you finally come up with a product, then it's tested and approved. Then you have to distribute it, and then each distributor has to get a small portion to pay for his existence. Bottom line, after research development, drugs here, the manufacturer ships it to the wholesaler marks it up, sends it to the pharmacist has to shelf it or inventory it until someone needs it. And all along you've had price, add on. Drugs are expensive. They're expensive to just come up with.
Chappell warns that prescription drugs can be harmful if not used properly.
Drugs are just that, drugs, and they can be very dangerous, just as they can be life-saving and helpful. They can be deadly and dangerous. So you have to be careful and know the limitations of the medications. And that's why we're here, the pharmacists, to safeguard the public.
The Chappells believe in a hands-on approach to serving their customers. They have a special concern for the elderly who are at risk for what some pharmacists call the shopping bag syndrome.
Well, the elderly really have to be very, very cautious when they take their medication. Number one, the elderly need to be maintained on the minimum amount, minimum strength-wise, in order to achieve the proper effect. Simply because their enzymes of the liver don't metabolize the drugs perhaps as effectively as a younger person, and therefore the toxicity of the drug builds up in the bloodstream, and many times the elderly are subject to having really, really bad side effects just due to the toxicity level of the drug. So they really need to be maintained on the minimum amount. Number one, they don't. Number two, they don't need to have the Schwagman shopping bag syndrome where they have maybe 10 or 15 prescriptions filled at one particular time, if that can be avoided. And number three, you really must counsel them and make sure that they're taking their medication properly.
For more information about prescription medicines as well as other health concerns, the Xavier University Drug Information Center suggests you acquire a copy of Health Hotlines, published by the Department of Health and Human Services in cooperation with the National Institutes of Health and the National Library of Medicine. Also, if you live in the New Orleans area, there is TelMed, a public service of Southern Baptist Hospital and the Orleans Parish Medical Society. For more information on TelMed, you can write to New Orleans Parish Medical Society at this address, or ask your doctor or pharmacist for a copy of the brochure. Our next feature takes us to Samaritan House, Project Safety Net, a nonprofit charitable and educational organization that's trying to better the lives of runaway teenagers. When a juvenile commits a crime, he can be held in jail, reform school, or some other facility for juvenile offenders. If he is on drugs, there are places he can go to dry out. But what about the runaway, who is perhaps seeking freedom from physical or sexual abuse, alcoholic or fighting parents, severe neglect or pregnancy? Where can a teenager go when he feels that there is nowhere to turn for help or shelter? Well, in the Baton Rouge area, there is a place opening soon for these troubled teens. Samaritan House Project Safety Net was founded by Lil Barrow-Veal, a former school teacher who saw the need for a place where troubled teens could seek shelter.
I'm a teacher, a former teacher at Baker High School, and the students would always come by. They loved me. They would come by and talk with me. And they would, from time to time, they say things like, "Miss Lil, so-and-so ran away from home," or "I'm leaving, you know, my mom this, my mom that." And I say to myself, I say, something's got to be done. And I have some friends in Washington. So I called D.C. and was, you know, checking to find out what could be done for, you know, these kids with these kind of problems. And a friend of mine called back and he says, we have some Stuart B. McKinney money. Of course, I didn't know who Stuart B. McKinney was, but Stuart B. McKinney was a congressman who initiated the homeless bill. Of course, he's died since then, and they had appropriated $1 billion for the runaway and homeless children. And they told me to do a proposal, of which, you know, I got busy trying to work on, and I sent it in. And in July, they called me to come to, you know, defend the proposal. And I had included in that proposal that we would deal with kids from New Orleans also. and they felt that we had a bigger problem here according to the statistics that I gave them, that we should narrow it down just to Baton Rouge. And we rewrote it, resubmitted it, and the last of September, we were awarded.
The Baton Rouge Police Department estimates that up to 8,000 teens in the Baton Rouge area run away from home each year. But when there is no crime committed, there is nowhere to take them. That is why law enforcement officials are helping in every way possible to make Samaritan House a reality.
In law enforcement, of course, there are a lot of law enforcement agencies involved with the project, and we're just one. And what happens is that runaway youth and children that they do find on the streets and that sort of thing, there's no place to put them. And this gives us a place to actually put a child if they're picked up on the streets, but we had no other place to put them before this time, so it's kind of hard. And that's why so many law enforcement agencies are taking part in this project, because they really can see a need for it.
Demetria McJulien and Harold Butler both serve on the board of directors for Samaritan House. Chairman of the Department of Social Work at Southern University, Dr. McJulien feels Southern University's involvement will be beneficial to the students as well as the teens they help at Samaritan House.
From a professional perspective, it's very important that I keep up with the kinds of things that are going on in the community. I happen to be interested in children and youth, and I teach a course entitled Services to Children. So this kind of exposure helps me to link the book learning with the practical kinds of experience. Our program also is very committed to working in the community, and one of the purposes of Southern University also deals with service. And we see our role as being able to provide supportive services to the community agencies, and Samaritan House is one that we have chosen to work during this interim.
It's long overdue for our kids who have run away. Somewhere they can come for shelter and counseling, and hoping that we can link them back to their parents.
Although Samaritan House has not formally opened its doors, phone calls have been pouring in from teens and parents who need help.
Yes, I received another call from a parent who was concerned about one of their stepchildren that was leaving in the morning, not going to school, but like on Friday she would leave. This was a female that would leave and would not return sometime on Monday or Tuesday, and they was very concerned, this particular parents, about it, and was seeking information on what could they do about this child, and she was not attending school.
Many times parents don't recognize the peer pressure, the pressure that the child gets external to the home. Now, some of the problems with runaways are within the home. Often it's the peer pressure. They see older children doing certain kinds of things, and they think that they can do them equally as well. So they don't adhere to the rules and regulations that a parent sets up. And the parent keeps working. You know, they utilize various forms of discipline. They may seek pastoral counseling. They may do a number of things, but it still does not work. One of the other kinds of problems is that there are not very many places that a parent can go where it's not a fee attached. And the agencies that we have had in the community now have fewer staff, and the waiting list is so long, and we've gotten some calls where the parents have been very frustrated about problems that they see, or potential problems, and they aren't able to get a service for a child until months later, and the problem is more immediate. So that's one of the reasons. It's not that parents don't try to get counseling, and they don't see the problem. They feel that they will be able to do something about it, and it just doesn't work that way.
Stephen Triche, a college student who hopes to have a summer job at Samaritan House, has been working as a volunteer to get the house ready for residents.
I didn't realize how many there were. When I met Lil and Jerri, they introduced me to another world that I was blinded to. I realized that in a given day, 8,000 kids can run away from home and nowhere to go. And if they, at least in the Baton Rouge area, they're trying to do something about it to where the kids have a place to run. And if a place doesn't have there's no place for the kids to run, and they're out on the streets, and that's the worst place for them. And hopefully this home will help them out.
Samaritan House will accommodate up to 20 teenagers. Although their federal grant of $147,000 has gotten the program off the ground, they will need much more to maintain their services.
When I first came to work here, we had absolutely nothing in this house. We had just the bare floors and the walls, and that was basically it. We have accumulated some things, but there are so many more things that we do need in order to house these children. We first and foremost need air conditioning. We have 2 units now, but the ducts are not run into certain portions of the house. So we're either going to have the ducts in or else we are going to need room air conditioners. I would say probably the second most important thing is a fence. We need 380 feet of cedar fencing plus the post and about 80 feet of wrought iron. And this would take care of the security things that we have around here. We've had a few thefts, and it would be certainly beneficial to us if we had the fence.
To me, it means helping the young people. They need somewhere they can go. Many times, these kids at home, if they just had somebody else to talk to other than their parent, they will be able to work out problems. And this is what we will be doing here. We will have a social worker, a master social worker, who can work with these kids, try and work out. It's a lack of communication many times at home. And if these kids had somebody to talk to while they're having problems at home, we're not saying if the parent problem or the kid problem, but they had somebody as a mediator to go to and try and work it out, we will help some of them. We're not going to save them all. If we save 1 or 2, we feel good behind that.
The doors of Samaritan House are scheduled to open very soon. For more information about their services or how you can help, please call 504-383-7266 or 1-800-673-0599. We close today's program with the fascinating music of West African musician Agboti from Togo, West Africa. We met Agboti at the recent Festival International de Louisiana in Lafayette. Agboti is one of the top entertainers in his country, and he found the people of Louisiana to be very much like those he left behind at home.
Warm, because the way they welcome us was, very, very surprising. Because we were not waiting people to know something about Agboti or Agboti's group or these Togolese coming to play, but we were surprised the way they received us. So I will tell, our people that it is good for man to travel and see what's happening at other places, because we are very, very happy. Louisiana people are very kind, very, very fantastic.
Mapamini kekere kemi mafi yummy 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 sairo. Mombe iwo ikuko fumila ye. Lati jeki yummy Jeremi. Mombe iwo ikuko fumila ye. Lati jeki yummy Jeremi. Lati jeki yummy Jeremi yo. Lati jeki yummy Jeremi. Bien des choses à toute la population de Lafayette. Vive Lafayette! Vive Lafayette! Vive la Louisiane! Vive la Louisiane! Okay, thank you, thank you, thank you, thank you. Lowo bikoni lari biyami kolewa bito dara yami 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 urami biyami kolowo bikoni lari biyami kolewa Dara yummy yummy, yurami. Emi yo sonrere, fún mama mi yo, títí ayé. Nítorí náà, ìwọ ikú jọ̀wọ́, má pa mí ní kékeré kémi, má fi yummy 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 sáyé. Wálé. Mo fẹ́ ìwọ ikú tó fún mi láyé. Láti jẹ́bi yàmi Jeremi. Láti jẹ́bi yàmi Jeremi o. Láti jẹ́bi yàmi Jeremi o. Láti jẹ́bi yàmi Jeremi. Jole. Láti jẹ́bi sama.
Well, that's all for this week's program. Be sure to join us next week for another edition of Folks. Bye-bye.
Allez, bonsoir. 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 Good evening. Thank you. Iami. 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 Giallorini. Iami. 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 Louisiana, Louisiana.